Hi, welcome to another episode of Mednate with Dr. B, and I am Dr. B, and today we'll be talking about the foundation on vital signs. So today I'm going to be teaching you some steps and some tricks when it comes to taking the vital signs. We're going to be looking at 7 of them. We're going to be looking at your blood glucose level using the glucometer. We're going to be looking at blood pressure. We're going to be looking at pulse rate or heart rate, the respiratory rate, temperature, BMI, and also we're also going to be looking at the pulse oximetry, whereby we check the oxygen saturation level. Okay, let's get to this. I also want to prepare you on how important it is to prep your equipment. First of all, you need to make sure all the things you need are properly prepped down before you get to business. So the first thing you do is obviously to wash your hands, or if you prefer to, and we get to business. Hi, I'm Dr. Busola, but you can call me Dr. B. What's your name, please?
Reverend Knight.
All right. So Reverend Knight, what's your date of birth?
October 4th, 1999.
Okay, thank you. So, how would you like me to address you, please?
Sir or Mr. is fine.
Okay, so Mr. Knight, I'll be basically doing vital signs on you today, and so please do I have your consent?
Yes.
Thank you. So from here on, we'll start with the pulse rate, which can also be called the heart rate. So 3 or 5 fingers, which is the index, middle, and your ring finger. Now, most of the time, students use just 2 of the fingers, but you cover more ground with 3 fingers. So you go over the inward of the wrist, just below the thumb, and we're trying to palpate for the radial artery. Now, it's the most superficial when it comes to checking for pulse, and also has the easiest access. Now you're going to check for the heartbeat for 1 full minute, 60 seconds. So I'm going to be counting for the number of heartbeats for 1 minute. Now the normal range is 60 to 100. Anything below that is bradycardia, anything above that is tachycardia. After checking for the rate, the next thing you have to check for now is the amplitude. Now, what does the amplitude signify? The strength, the intensity of the pulse. So you have a grading system. 0 signifies what? No pulse. 1 signifies a weak or steady pulse. 2 signifies normal pulse. And 3 signifies a very strong bounding pulse. Now, don't forget that you also check for the reading of the pulse aside the amplitude. Is it a regular reading or irregular? Now, the next thing I'm going to be doing right now is something called the radial delay. So, basically what I'm doing is I'm going to be palpating both ends, both radial artery. Now, what am I looking for? I'm looking for any form of inconsistency. The both radial artery should be both synchronized, meaning the time factor and the intensity should occur at the same time. So right now, there is no sign of radial delay. Now, what are the pathologies that could be associated with the radial delay? Like aortic dissection, coarctation of the aorta, it could also be aortic aneurysm, could also even be subclavian artery stenosis and the likes. Now, let's move on. We could also run that test. In fact, if you observe the patient has radial delay, you should check for radial delay immediately to compare. So basically, you're also checking the radial artery and also the femoral artery, which is at the groin region. So you're also comparing. We want to see that they are both synchronized. Now note this, the most common cause of radiofemoral delay is coarctation of aorta. Now, from there we go to the next thing, which is whereby we check for the collapsing pulse. Now, when you're checking for the collapsing pulse, you use your left dominant hand and place on your radial artery. Again, feeling the pulse. Then you ask your patient if he has any form of pain in the shoulder. Do you have any form of pain in your shoulder?
No.
Thank you. Then you use your dominant hand to raise the hand quick and drop. What you are expecting to notice if it's a collapsing pulse or watermark pulse is a rapid upstroke and also a rapid collapse, which signifies some form of regurgitation going on, like the aortic regurgitation. Now, with that, we're done with pulse. Then we'll move on to the next thing, which is very important, which is your respiratory rate. Now, one very important thing you should do is you must not let your patient know you're about to take your respiratory rate. Now, because it's a tutorial, now, usually when you are taking your pulse, you tell your patient to place their hands on their abdominal region and you observe while the patient is breathing. Now, the normal range for respiratory rates is 12 to 20 breath cycles per minute. What makes a breath cycle is inspiration and expiration. So your person is breathing in and breathing out. So you count that for 1 full minute, and you just, while you are checking the pulse, after checking the pulse, you do that immediately. And so if your patient's range is between 12 to 20 breath cycle per minute, it's normal. Anything below 12 is a bradypnea, and anything higher than 20 is what it's keeping. Now, we move on to the next one. This next thing, we'll be checking for the oxygen saturation level. Now, you just ask for either the index finger or the middle finger of the patient, please. And you place it at the tip. Then you click on it and relax the patient's hand. Now, it usually goes on for 10 to about 30 seconds. And yes, there we have it. Usually the normal range should be 95% to 100%. That's normal range for oxygen saturation. Thank you. And also it's used to confirm your pulse too, which is usually the normal range should be 60 to 100. And then we'll now be checking for the temperature using the thermometer. Okay, that's it. Now, usually the normal temperature range when it comes to centigrade is from 36.1 to 37.2 centigrade, while in Fahrenheit is 97 Fahrenheit to 99 Fahrenheit. Thank you. Now, we'll be checking for both weight and height. Now, when it comes to BMI, we have two forms of measurement. Either use the metric method or the imperial method. The metric method is where you check for the weight in kilograms, and you also check the height in meters. Then you check for the BMI by calculating by what? The weight in kilograms over the height in meters squared. That will give you a BMI. But when we're using the imperial method, which is the method I'll be using right now, we check the weight in pounds and we check the height in inches. Now the formula is weight in pounds over height in inches squared times 703. And that's that. So we're going to be using the imperial method right now. Please come. Good. So now I have his weight in pounds, and then I'll move on to check his height. Please keep coming down for me. I'm checking his height in inches. All right. All right. Thank you. And with that, I'll measure using the imperial method, which is the weight in pounds over the height in inches squared times 703. Usually, the normal range is from 18.5 to 24.9. Anything below 18.5 is underweight. Then, from 25 to 29.9 is overweight. Now, anything from 30 above is obesity. Okay, so now we'll be doing the glucose test. Now, it's very important to know what your equipment does. First of all, you need the glucometer and the test strip. Now, you also need the lancing device, and you also need the lancet, which is already placed in. So the first thing you do is you prep all your equipment. Also, you also need, very important, your alcohol prep pads. Now, the first thing I do is ask my patient, what have you eaten today?
Just a sandwich, some water.
Okay, why is that important? We have to differentiate between is the fasting glucose test or postprandial. Now that's very important. Also, I need to make sure my patient is relaxed. While I'm talking to my patient, you observe I'm trying to massage his finger. Now, be careful One of the best areas to prick is the tip of the finger. Now, you see, notice me massaging. The next thing I do after I massage is to take the alcohol swab and clean. The next thing I do is slowly, slightly prick my patient and I squeeze. After I squeeze, I place the glucometer here and wait as it reads. Good. After that, I remove the test strip, place here, place everything of sharps into the sharp box. Then I also clean my patient's hand, and with that, you're done with the test. Now, one thing that's very important that you should know, the range of fasting glucose. When it comes to fasting glucose, is from 70 to 110 mg/dL. While when it comes to postprandial, you can let it go to 140. Anything above 140, then I should worry if my patient is in a state of pre-diabetic or diabetic state. So the next thing we're going to be doing right now is to check for the blood pressure. Now, very important, you see my patient is seated. And also another thing you need to make sure is that the antecubital crease, where you have your brachial artery, is on the same level with the heart. So that's why my patient is sitting like that. Now you make sure your patient is well rested. Very important, because you want to prevent any form of white coat hypertension or white coat syndrome. Okay, then the first thing you do is wear the cuff, the blood pressure cuff. Now, how do you wear it for the patient? These are the important things to note. The first thing you need to note is your cuff should be about 2.5 centimeters away from the antecubital crease. And also where you have artery showing should be where it should be facing, where you have the two pipes. Now, let's go. So about 2 of the fingers will be approximately like 2.5 centimeters. So you do this. And so you have an idea of where you need to stop. Now, while we have that sorted, the next thing you do is, when it comes to blood pressure, we have two methods, and they are both important. You have the first method, which is the palpatory method, and the second method, which is the auscultatory method. The palpatory method, the first thing I do is I try to palpate for the radial artery. Then I inflate. Now, while I inflate, the point at which I stop feeling the pulse, I note it. And that's my rough systolic. Now, after doing that, you add 30 millimeter mercury to that. So for example, my patient tone was 120. So now I'm going to be inflecting to 150. That is, I added 30. Now, this is the auscultatory method. We're going to be doing that. Now, usually people often use the diaphragm to place at the brachial artery position, but the best is still the bell. Why is it important? Because the bell listens to what? Low pitch sound. The diaphragm is more for loud pitch sound, like your lungs and the bowel sounds. So right now, I'm going to be placing where my starts. Good. So you can see the switch, you can switch it on and switch it off and confirm by just tapping. Now, I'm going on with the auscultatory method now. The first thing I do is I will inflate it to 150. Now, based on my rough systolic, which was 120, added 30 mmHg. Then I slowly deflate. So the first sound, the tapping sound, signifies your systolic pressure, and the last one, which is silence, signifies your what? Diastolic pressure. With that, with my patient, it was about 110 and 78, which tells me which normal range now for systolic and diastolic is less than 120 for systolic and less than 80 for diastolic. So that's a normal range from a patient. Okay, so after you're done with the examinations, the next thing you do is to summarize your findings to your patient and tell the patient. So, Mr. Knight, after checking your pulse, your respiratory rate, your glucose level, your blood pressure, your BMI, your pulse oximeter, your temperature, all the findings were within normal range. So thank you for coming and have a lovely day.
Thank you.
Okay, thanks so much for watching this video. This is to encourage you to practice more, better. We need us to become more better doctors and also to help the society at large. Please don't forget to subscribe, to share, to like, and thank you for watching the video. See you some other time. Bye. Then we'll move on to the next step, which is temperature. Now we'll be using the thermometer to check for its temperature. This is no.